All right, let's talk about some general lifestyle causes of poor mental health. The biggest lifestyle cause of poor mental health in Ayurveda is irregular routine. That could be anything from a lack of sleep or to excessive sleep. It can include a lack of exercise, a general lack of structure in your life, which leads to depression. I have a friend who is soul searching right now, quit his job a few months ago, and I just spoke with him the other day, and he was basically, lost all routine in his life at this point because he has no structure. He can be up till 2 a.m, 3 a.m, and then waking up late and just kind of really not in a rhythm, a little bit disorganized. And so that lack of structure can create mental health issues. Overworking can create mental health issues too, like this poor young man in the photo. Stress and difficult circumstances can cause poor mental health. A bad relationship, a recent divorce, a lack of a relationship, a death of a loved one, a medical condition, stress, pain, poverty, etc. All those can cause mental health issues. Too much thinking, poor behavior choices and addictions or drug use. All those can cause poor mental health too. Trauma can cause poor mental health. Excessive grief, anger, or strong emotions. I went through a distressing situation, and I was, that I was very emotional about once, and it had an effect on my mental health. Trauma. What is a trauma, by the way? I think it's really important because this word gets thrown around that we just know what a trauma is. And a trauma is a deeply distressing or disturbing experience. Now, that doesn't mean that that what was done to the person was a terrible thing. It just means that they were distressed and that they were very disturbed. And one person can, get in a car accident and lose their leg, and they can get through it fine, in terms of their mental health. Another person, that would be catastrophic for them. And so it can, how a trauma affects a person very much depends on their temperament and mental health. But by definition, a trauma is something that is hard to face. It's really hard to digest the trauma. It's hard to people have developed defense mechanisms to avoid the trauma. So if they could face it, then it probably wasn't a trauma for them. By definition, they can't. It's a trauma because they can't face it. So they may be aggressive or go into denial or vacate or make jokes about it, etc. Anything to avoid having to feel the trauma. So when you notice a client has trauma or any strong mental health issue, you're going to refer out to a professional in that area. Pain has a strong effect on a person's mental health, but a spiritual practice, and numerous studies have shown this, that a spiritual practice can minimize the effects of pain on a person's psyche. Exposure to heavy metals and toxins and radiation can cause poor mental health. Loss of function in the brain, such as from dementia or Parkinson's or an injury to the head, can cause poor mental health. Hyperactivity and hypoactivity can cause mental health changes. What are some treatments for better mental health? Well, a good routine. Sleeping 6 to 8 hours a night. Having a spiritual practice is a strong way to improve your mental health. Focusing on one task at a time. And also, Ayurveda includes Nasya oil as a treatment for mental health to clear the doshas from the mind. Body work can be really helpful. Getting a massage can be very helpful for mental health. Stretching, releasing tension in various ways, and also cranial sacral therapy can also help with mental health. What about breath work as a treatment for mental health? Well, taking 10 deep breaths can reduce a person's tension, but also excessive focus on the breath can aggravate vata. So it depends on the person's doshas. It depends on their issues. If they're a spaced out person, breath work may not work. If they're too much in their heads, breath work may not work. Breath work could aggravate it. So, again, that's going to really depend on the individual.